Hi, this is Dr. Ben Kittredge from OrthoVirginia. I work out of the Alexandria and Springfield offices, and I'm here today to talk about who needs a shoulder replacement. And so just to start off, understanding what the normal shoulder anatomy looks like, so people have an idea of what we're talking about. This slide here or cartoon shows the humerus and the scapula or the shoulder blade, and where the cursor is here, you can see that the humeral head and the glenoid or the socket, that makes up the shoulder joint. This is also looking at the muscular anatomy of the shoulder. Everybody's heard of the deltoid muscle, which you can see on the picture on the left, but underneath the deltoid muscle are the four muscles that make up the rotator cuff. They have fancy names you don't necessarily need to remember: the supraspinatus, infraspinatus, and teres minor, and the subscapularis. So those are the four muscles that make up the rotator cuff. Who needs a shoulder replacement? Well, the two most common causes of the need for a shoulder replacement are arthritis and massive rotator cuff tears. So if you look on the slide on the left, you can see what a normal joint might look like. And so there's the ball in the socket or the humeral head and the glenoid. And then the middle picture shows what an eroded or arthritic shoulder might look like. And so that's what arthritis looks like. On the picture on the far right is what a rotator cuff tear would look like. And so where the cursor is, you can see where the tear is located. So the number one reason people need to have their shoulder replaced is arthritis. Osteoarthritis being the most common cause, and that's a progressive biomechanical breakdown of the articular cartilage or joint surface or cartilage on the ends of the bone. And that picture on the left side is trying to depict the cartilage or cushioning rubbing away from the ball in the socket. What do people complain about the most? Well, pain sleeping at night is really the most common complaint that people have. People will complain of stiffness or loss of range of motion, but it's really the pain at night, the deep aching pain people have, that drives people crazy. So how do you figure out whether somebody has arthritis? Well, we start by coming in the office and taking an x-ray. And if you look at the x-ray on the left side, where the ball and socket is, the cursor's between the ball and the socket, and that shows a normal joint space. If we go to the right side, the right picture, you can see that the ball and the socket where the cursor is, there's no joint space left. And just like it says there, this decreased joint space. And so that's what bone touching bone arthritis looks like on an x-ray. So what do you do for arthritis in the shoulder? Well, it doesn't start with a shoulder replacement. It starts with activity modification, taking some medications like Motrin or non-steroidal anti-inflammatory drugs, NSAIDs. Sometimes we'll send people to physical therapy. If those two things don't work, we may try a cortisone shot. If none of the non-operative treatments work, then we're left with a shoulder replacement as the solution to the arthritis problem. The number two reason to have your shoulder replaced is a rotator cuff tear. Now, these cartoons here are showing you the rotator cuff and what a rotator cuff might look like. So if you look at the picture on the left with the red circle, that shows you what a tear or hole in the rotator cuff would look like. The middle picture also shows another depiction of what a rotator cuff tear would look like. And then the picture on the right shows an arthroscopic view of what a torn rotator cuff looks like. Rotator cuff tears typically are similar symptoms for arthritis: pain sleeping, pain with overhead activity, pain reaching behind your back, having some weakness, but there's really no stiffness when it comes to rotator cuff tears. So rotator cuff treatment is somewhat similar to start with. We oftentimes will start with anti-inflammatory medicine, Motrin. We may start with physical therapy, maybe with a cortisone shot. The last choice for a smaller rotator cuff tear is a rotator cuff repair. And the cartoon on the right is trying to show what an arthroscopy looks like, where we make some small holes in the shoulder. And the inset picture there shows what a rotator cuff repair might look like. When people have massive rotator cuff tears, they come into the office looking like the patient in the picture on the left. If you look at the right shoulder, it is elevated significantly greater than the left. And so in that picture, the person is trying to lift the right arm above their head and they can't move it at all. And when they can't move it all like that, we know that that person has a massive rotator cuff tear. So what does that look like on an X-ray? So the pictures on the right, the middle picture shows, again, a normal looking X-ray, but on the far right picture where the black arrows are, the ball has what we call superiorly migrated, or has moved up towards the ceiling with respect to the socket. And so that's a classic appearance of somebody who would have a massive rotator cuff tear, and that's what the X-ray would look like in an office. Other ways to diagnose this, the picture on the left shows an MRI, and so where the red arrow is, that shows where the rotator cuff is torn. The green arrow shows where the rotator cuff is supposed to connect, and so the space between the red arrow and the green arrow is a gigantic space in the rotator cuff world, and that is what we call a massive rotator cuff tear. The picture in the center shows an arthroscopic view of a massive rotator cuff tear. So we're looking at the ball in the socket, and you're really not supposed to be able to see that. And so the rotator cuff should be covering the ball in the socket, and it is nowhere to be seen because it's a massive tear. So even having said that, with a massive tear, you can still try conservative or non-operative treatment. That can consist of physical therapy, cortisone injections. An attempted repair depends really on the size of the tear itself. And when people have massive rotator cuff tears, a reverse shoulder replacement is the solution to the problem. So there are two types of shoulder replacements. There's an anatomic and reverse. So the picture on the left shows where the ball has been removed and a new titanium or cobalt chrome ball has been replaced. And then you can see where the socket is a piece of plastic or polyethylene. So the anatomic total shoulder replacement puts a new ball where the original ball was and puts a new socket where the original socket was. If you look at the picture on the right, that is what a reverse shoulder replacement is. And the reason it's called a reverse shoulder replacement is because you put a ball where the socket is and a socket where the ball is. And that's what a reverse shoulder replacement is. So these are some pictures of what an anatomic shoulder replacement looks like. The picture on the left is a stemless anatomic shoulder replacement where we've just replaced the ball and the socket. The picture on the right shows a ball with a metal stem going down the humeral shaft. And so those are the two types of anatomic shoulder replacements that you can do. These views show you what a reverse shoulder replacement looks like. And so the picture on the left shows a small stem in the humerus with a socket, and then a typical ball on top of a plate that has several screws going into the socket. And then picture on the right just shows a longer stem reverse shoulder replacement. But it gives you the sense of the portion on the right shows a very central thick screw with what we call our peripheral screws, and these all go into the socket. So before we do a anatomic or reverse shoulder replacement, we do surgical planning, and that consists of doing a CT scan preoperatively. And the CT scan is then sent to the vendors that make the shoulder replacements, and they do 3D reconstructions. And the picture on the left here is showing you the preoperative planning and the guide that is made to drill holes in the socket so that we put everything exactly where we want to place it from the preoperative CT scan. So which shoulder replacement do you have? Do you have an anatomic or a reverse? How do you decide? So the anatomic shoulder replacements require an intact rotator cuff. I put in age with a question mark because the indications for which one you use have changed over time. And so in this country, more and more shoulder replacements are of a reverse shoulder replacement variety than an anatomic. And that is based on mostly the condition of the rotator cuff. And so historically, reverse shoulder replacements were done in an advanced age, 80 or more. These days, 60 can be the cutoff, or depending on the condition of the rotator cuff, it may be in your 50s. So it very much depends on the condition of the rotator cuff, whether or not you do an anatomic or reverse shoulder replacement. The other issue is activity level. When people want to continue doing heavier weightlifting or they're more active at a younger age playing tennis, you may want to lean towards doing an anatomic replacement. Though all these possibilities exist with reverse shoulder replacement, short of doing heavy weightlifting. The pain relief and function are very similar for both, and the trend in this country is moving much more towards doing reverse shoulder replacements than anatomic replacements. So what does it look like? So on the day of surgery, the picture on the right is what a typical operating room would look like. Usually this is done under general anesthesia, with what is called as a regional nerve block by the anesthesiologist. The operation takes 90 to 120 minutes. It's oftentimes done as an outpatient. Occasionally we do it in the hospital, but more often than not, it's done at a surgery center. So what's the recovery look like? Well, we have people wear a sling for 6 weeks. We don't send people to physical therapy for 6 weeks. And the recovery is somewhere between 3 and 6 months long. After 6 months, people can play golf, pickleball, you're able to walk, swim, lifting light weights. So the recovery is somewhat variable. And so for some people, it's as short as 3 months, but sometimes it's 6 months. So what are the risks of surgery? Well, the risks of any type of surgery include bleeding, infection, damage to blood vessels and nerves. Those risks are pretty small when it comes to shoulder replacements. There are some specific risks that are a little bit different with a reverse shoulder replacement. That includes a stress fracture or a dislocation. Those risks are still small. And the biggest risk with an anatomic shoulder replacement is a rotator cuff failure, which is part of the reason that I think more people are leaning towards doing a reverse shoulder replacement more often than anatomic shoulder replacements these days. So how are the results? That's what the most important thing is. And so whether it's an anatomic shoulder replacement or reverse shoulder replacement, both result in significant pain reduction and very significant improvement in motion and functional improvement. They have very high satisfaction rates, somewhere around 90% at the 10-year mark. In summary, I would say that shoulder replacements are some of the most successful operations that I do, but I would also say that the people who need them are have the greatest difficulty sleeping, oftentimes sleep deprived, and are a lot of times miserable because the shoulder hurts so much that it stops them from being able to sleep. Okay, thank you. That's it. That's all I have for the presentation. I'm happy to answer some questions if people have questions.
We do have questions. Thank you so much, Dr. Kittredge. So we will be answering questions submitted earlier and questions submitted live. Not all questions will be able to be answered, but we will get through what we can. So one of the questions that came in was, after a shoulder replacement, is there a reduction in strength and range of motion? I'm concerned I won't be able to do my usual workouts and sports.
So the first thing I would say is heavy weightlifting is not recommended after having your shoulder replaced. Some people who need their shoulders replaced have been heavy weightlifters in the past, and that's just one of the modifications that people will have to make. If the shoulder replacement doesn't give you the shoulder you had when you're 16, but it is an absolutely great operation. And so the hope is that you improve your range of motion compared to the preoperative situation. And then if you want to lift weights, it has to be light weights, 5-pound, 10-pound dumbbells, probably not a lot more than that on a repetitive basis. But you can play tennis, you can go swimming, pickleball, like I said beforehand, walking, you can do yoga, but you don't want to be doing push-ups as an example. So there has to be some modification in what the expectation is as far as workouts go.
Thank you. One of the questions we had earlier was specifically asking about rock climbing. It sounds like that might not be allowed after shoulder replacement based on what you just said.
I think rock climbing would be a fairly high risk endeavor, because if you have your hand on a hold while you're rock climbing and you lose your footing, then you're holding on to your entire body with a one hand potentially. And that would not be recommended. And so that would be another example of a modification where I wouldn't recommend doing that. I'm sure people try it, but I wouldn't recommend doing it.
Thank you. Is it feasible for someone who lives alone to get a shoulder replacement, or do they need too much help?
Well, it's a great question. It's a very common scenario, actually. And so what I usually try to recommend is I try to recommend either having a family member or a friend hang around or spend the night for a day or two after surgery, just until the patient wakes up and feels like they're on their own. But with regard to whether it's a reverse or anatomic shoulder replacement, people are able to get around pretty well after a day or two. And so it's probably not a great idea to go home by yourself right after surgery to have no one there. But really, you only need somebody to hang around with you for a day or two. If it can be longer, that's even better, but a day or two, which should be sufficient.
Thank you. What causes rotator cuff tears?
So rotator cuff tears come in two varieties. The most common variety is a degenerative tear. And so as we age, our rotator cuffs degenerate. So these are some statistics. If you look at a population study of 40-year-olds, 7% of them will have a rotator cuff tear. If you go up into your 50s, 15% of 50-year-olds will have a rotator cuff tear. If you get to your 60s, 25% of 60-year-olds will have a rotator cuff tear. In your 70s, that number goes up to 45%, and in your 80s, it goes up to 55%. And so the message here is if we all live long enough, we will all get a rotator cuff tear. But again, it is degenerative in nature most commonly. Now, you can fall down the stairs and tear your rotator cuff as well. That's what we call an acute rotator cuff tear. But that's not as common as the degenerative type. And most people with massive rotator cuff tears that need a reverse shoulder replacement have a degenerative type of rotator cuff tear.
Thank you. If you don't get a replacement, will the condition get worse? And is it possible to wait too long?
So I would say it depends on the problem. So with arthritis, most people will not wait too long, and then the pain sleeping at night really drives them crazy, and they just can't sleep. Rarely people can wear out their shoulder and wear out the socket, and so it's possible to wait too long. But that's something you can be determined inside an office. If you come see a shoulder specialist, we can take an x-ray in the office, and we get a pretty good idea just from the x-ray how much wear and tear has occurred. As far as a massive rotator cuff tear, what happens if the rotator cuff tear gets too large is you start to lose the ability to lift your shoulder at all. And that is what we call is pseudo paralysis. In other words, it's like your shoulder or arm is paralyzed. And that picture of the person I showed with the arm with the shoulder elevated, that person has what they call a pseudo paralysis, wherein the rotator cuff tear has gotten so large the person can't lift their arm up. And it's not too long at that point, or you haven't waited too long to have a reverse shoulder replacement. It's just that at that point, no physical therapy, nothing is going to work short of having your shoulder replaced.
Thank you. What metals are used in the shoulder replacement implants? And if you have metal allergies, is a replacement still possible?
So most of the ball, if you look at any of the manufacturers, the ball is made out of cobalt chrome. The stems are frequently made out of titanium. And so even in the face of a nickel allergy, people are able to have shoulder replacements, and it really has not been a problem. So most metal allergies are nickel, which is a component of stainless steel, but really a minimal component in a cobalt chrome humeral head. And so it really is not much of an issue.
If someone has osteoporosis, how likely is a shoulder replacement to be successful?
So osteoporosis doesn't mean you cannot have a shoulder replacement, but it does put you at an increased risk of getting a stress fracture. And so most people with osteoporosis are going to be getting a reverse shoulder replacement. And so one of the things that we try to do is not send you to physical therapy for the first 6 weeks. It's somewhat controversial whether taking medication prior to having your shoulder replacement to improve the osteoporosis makes a difference. If people do get a stress fracture after their shoulder replacement, those usually heal within 3 or 4 months. They don't usually require a separate type of operation. There's some different medications we can use if somebody does develop a stress fracture. But ideally, if you have osteoporosis diagnosed before surgery, then there's a discussion with your primary care doctor whether or not some of the agents like Boniva or Prolia or Actonel would be something reasonable to try to increase the bone density prior to having your shoulder replaced.
Thank you. So someone asked, I've heard that you can have a reverse replacement after a total replacement, but not a total after a reverse. So young people should always have a total replacement if possible. Is that correct? And can you explain?
Right. So that is probably the case. I mean, most of the time, you're not going to do an anatomic replacement after a reverse. And so the doesn't mean that it couldn't be done, but that would not be a mainstream treatment. Usually, if somebody has a reverse shoulder replacement that fails, you get a second reverse shoulder replacement. The biggest reason is because if you've had a failed reverse shoulder replacement, you've left a defect in the socket. And so for an anatomic replacement, building that back up with bone graft probably would not be very predictable to be successful. So I would say in general terms, younger people, and younger is a very relative term, that could be 70, could be 60, could be 50, may lean towards an anatomic replacement, but it really depends on their health status, their activity level, and the status of the rotator cuff.
That is the questions that we have for today. Dr. Kittredge, would you like to close?
Thank you very much for listening to this talk. I hope it was helpful. And what I would leave you with is that when people have arthritis or giant rotator cuff tears, there is hope. And I would tell you that not being able to sleep is miserable. And sometimes people don't realize how sleep deprived they are until they're able to get some sleep. And that's where the shoulder replacement really comes into play. That deep aching pain that people have when they sleep is gone instantly when they wake up from surgery. So there's hope. Let me leave you with that.